On this episode, we will talk about the side effects of semaglutide, also known as Ozempic, or the weight loss drug Wegovy.
3, 2, 1.
Here we go!
The search for effective and safe weight loss treatment seems never-ending, but the newest anti-obesity medication, semaglutide, is still making waves more than a year after its 2021 approval by the U.S. Food and Drug Administration. The injectable drug, initially only used as a diabetes medication, is the first drug since Saxenda in 2014 approved to treat chronic weight management in 70% of American adults who are obese or overweight. Research continues to show the effectiveness of semaglutide injections for weight loss. It also highlights the value of treating obesity as a chronic metabolic disease instead of expecting people to rely solely on willpower and lifestyle changes to manage their condition. But semaglutide is not a miracle drug, and it's not for everyone. We need to remember that obesity is very complex, and it's not one size fits all. Semaglutide belongs to a class of medications known as glucagon-like peptide 1 receptor agonist, or GLP-1RAs. It mimics the GLP-1 hormone released in the gut in response to eating. The role of GLP-1 is to prompt the body to produce more insulin, which reduces the sugar or glucose levels. For that reason, healthcare providers have used semaglutide for over 15 years to treat type 2 diabetes. So this is not a new drug at all. But GLP-1 in higher amounts also interacts with parts of the brain that suppresses your appetite and signals you to feel full. When used in conjunction with diet and exercise, it can cause significant weight loss and reduce the risk of cancer, diabetes, and heart disease in people who are obese or overweight. Currently, semaglutide is only approved for weight loss under the brand name Wegovy. The typical dose for weight loss is 2.4 milligrams administered weekly as subcutaneously or under the skin, and these are self-injections. But as interest in semaglutide for weight loss continues to grow, healthcare professionals are finding ways to manage the demand. Many prescribe other brands of semaglutide, such as Ozempic or Rybelsus, and they are off-label, using a drug that is FDA approved for a different reason. Currently, the demand has become so high that now there is a shortage for people who need this medication to help manage their diabetes. There have been several anti-obesity medications that help suppress appetite and achieve weight loss, but semaglutide performs on a new level. An early study of 2,000 obese adults compared using semaglutide plus diet and exercise program with people who made a same lifestyle change without the semaglutide. After 68 weeks, half of those participants using semaglutide lost 15% of their body weight, and nearly a third lost 20%. Okay, so now let's talk about side effects. The side effects of semaglutide are typically mild, especially when compared with the complications associated with overweight and obesity. People taking the medication, taking semaglutide for weight loss, may experience dizziness, fatigue, gastrointestinal issues such as diarrhea, constipation, gassiness, headaches, stomach issues, including nausea, vomiting, pain, distension, or bloatingness. Gastrointestinal issues are the most common complaint among people that are starting semaglutide, but you're able to reduce the side effects by beginning on a lower dose and then slowly increasing the amount you take. Now let's talk about severe side effects. Semaglutide injection may increase the risk that you will develop tumors of your thyroid gland, including medullary thyroid carcinoma, a type of thyroid cancer, and laboratory animals who are given semaglutide develop these tumors, but it is not known if this medication increases the risk of tumors in humans. Tell your doctor if you or anyone in your family has had a thyroid cancer or multiple endocrine neoplasia syndrome type 2, also known as MEN2. It's a condition that causes tumors in more than one gland in your body. If so, your doctor will probably tell you not to use semaglutide injection. You should avoid semaglutide if you have a history of the medullary thyroid carcinoma, history of gallbladder disease, history of pancreatitis, the multiple endocrine neoplasia syndrome, that's type 2 MEN or MEN2. So the take-home message, if you're considering semaglutide for weight loss, your first step should be consulting your primary care physician, your PCP. They know your personal and family medical history, and they can guide you in the best treatment for your condition. If you have diabetes and already take a different medication, talk to your physician about acceptable and safe combinations of diabetes medication. So there you have it. That is some of the side effects and some of the information that we know about this medication. I hope you found this useful. If you did find this useful, please leave me one of these. I really appreciate the support on the channel. And don't forget to subscribe for future episodes. That way you don't miss any of our future videos. I'm Dr. Álvarez with Endobariatric.com, where we are changing lives one sleeve at a time. Take care and God bless.